Hi, my name is Dr. Sudeep Singh Sachdev and I am currently working as the Director and Senior Consultant of Nephrology and Renal Transplantation at Narayana Superspeciality Hospital, Gurugram. Today, I will be talking about CKD or chronic kidney disease, which is one of the most common presenting diagnoses in OPD today. So, chronic kidney disease by definition is a permanent, irreversible, progressive, gradual decline in renal function. Now, coming to the various causes of chronic kidney disease. Chronic kidney disease can be caused by many diseases, the most common of which are diabetes mellitus. As we all know, with time, we are facing an epidemic of non-communicable diseases like diabetes mellitus. And diabetes not only hampers the heart and the brain, but it always affects the kidney as well, and that also at an early stage. So, diabetes is one of the most important causes of chronic kidney disease. Other than this, I feel that hypertension or high blood pressure is another cause. Then there is a disease known as chronic glomerulonephritis. This could be genetically inherited, or it is a disease in which there is protein leakage and leakage of RBC out of the kidney, which causes progressive deterioration of the kidney function. Other than that, there are other factors, for example, painkillers which can lead to kidney damage, and certain other kinds of metallic compounds which, if taken for a long period of time, can also cause chronic kidney disease. Also, multiple infections like urinary tract infections affecting the kidney, or certain genetic causes, for example, autosomal dominant polycystic kidney disease, can also cause a progressive deterioration in renal function and can lead to end-stage renal disease. Coming to the symptoms of chronic kidney disease. Now, chronic kidney disease can present with various kinds of symptoms. Early ones would include the patient starts to have swelling around the eyes, which we call as periorbital edema, which comes around the eyes. Then we have edema at the dependent part of the body, what we call is the shin of the tibia or the lower feet. So, once you touch that and you put pressure on your tibia, you will see a pit forming. Such type of edema classically is defined as a pitting edema and denotes that the protein leakage in the kidney has already started. Other than this, there are some non-specific symptoms. For example, patient would have weakness, decreased appetite, one starts to refuse food, the favorite food which one used to like few years back, and refuse it completely. Other than that, you have nausea, there is a sensation of early morning vomiting. So, the patient, when he goes to the bathroom for brushing his teeth, there is a tendency to vomit completely, or the patient vomits. Then one starts to develop dryness and itchiness of skin. So, the skin starts to become really dry, and you can see that when a chronic kidney disease stage 5 patient walks in, you can see itching marks all over the body. Other than this, patient starts to develop a low hemoglobin, which one can easily see in the underside of the conjunctiva of the eye. Other than that, the patient starts to have high blood pressure, and high blood pressure can lead to various complications including retinopathy, stroke, can even precipitate coronary artery disease and other symptoms. So, there is a wide variety of holistic symptoms which I have already mentioned, with which a patient of chronic kidney disease can present. Now, coming to the treatment of chronic kidney disease. If you have had chronic kidney disease, one should not think that it is the end of the world. You should report to a nephrologist as early as possible. So, the problem is that the kidney disease is a silent killer. Why do I say that? The early symptoms are usually non-specific. So, by the time when the patient actually presents to a nephrologist, he is in an advanced stage or a stage of kidney failure. At that moment of time, when you present in a stage of kidney failure, there are only two options available to a nephrologist. One is kidney transplant and the other is dialysis. Now, in the early stages, that is in the stage CKD 2, 3 and 4, at these stages it is extremely important to get your tests done to diagnose chronic kidney disease. And when I talk about these tests, I mean urine tests, which would tell us whether the urine routine is normal or there is some protein leakage or RBC leakage or WBC leakage, then a urine culture sensitivity if there is an underlying infection, and ultrasound imaging of the kidneys to see the size of the kidneys. As the disease advances, the size of the kidney shrinks. So, it also is a marker that how long the disease has been prevalent and in what stage the patient has presented to us. Other than that, the blood investigations would include a kidney function test, and the simple most important predictor of the progression of chronic kidney disease is serum creatinine. And if the serum creatinine has a low value, means your kidney function is good. As it starts to increase, the kidney function deteriorates, and higher the value of creatinine, more are the chances that you are going to end up into kidney failure sooner rather than later. So in stages CKD 2 to 4, we give patient medication in order to optimize the metabolic derangement in parameters. For example, there can be calcium deficiency, so we add calcium tablets. There could be excess of phosphorus. Then we give certain medication and injection to improve the low hemoglobin or anemia which happens in chronic kidney disease. Then we give blood pressure lowering medications, and we give anti-diabetic medications in order to control diabetes, because uncontrolled diabetes and blood pressure would lead to a progression of kidney disease at a fast rate. So in the early stage, we control diabetes, control hypertension, give medication to control the metabolic parameters, and basically find a strict dietary plan and stick to it. So the kind of diet which a patient has to take would be a salt restricted, a protein restricted, and as the disease advances, a potassium restricted diet. So we follow the dietary plan and we take the medications. So even though chronic kidney disease is a silent killer, it is a disease which is becoming extremely common, whereas in 1 out of 10 people are now having some sort of chronic kidney disease in terms of the urinary parameters or their renal parameters, that is the blood tests. Do not worry too much, do not fret. This disease can be controlled, it can be delayed, the progression of the disease, and the earlier you report to a nephrologist, the better. However, even if you present in a late stage, a stage where you have to undergo dialysis, one can lead an absolute normal quality of life after getting a kidney transplant, and he or she will not even be noticed as a patient if one sees from a neutral eye. So thank you so much, and please follow these advice. Thank you.